Hello, everyone. I am just waiting for Gail. Hold on. There we go. Hello.
Hi. I was waiting for the link and realized you sent it to me a lot earlier, so we're here.
Yes. Sorry. All right. So let me get onto Facebook. It'll just take a second here. Then I will introduce you. My goodness. Okay. So here's this.
I think you look great.
Oh my gosh, you should have seen me earlier. I looked like a Smurf.
Yep.
I was laughing so hard I was
A lot
crying.
of times mine goes around the edge of the face, but not crossed it.
Okay, wait. Okay, so here we go. Okay. Just dismiss that and then go live. I wish it didn't take so long. Okay. I'm going to go live anyway.
You know more than I do, that's for sure.
Been learning. Hopefully. Okay. I believe we are live. I have to watch it on Zoom. Okay. Wait, let me get on my phone, make sure. Well, my phone always takes a second to catch up. Okay. So anyways, hello, welcome everybody in the Holistic Hounds and Humans group. Tonight, I'm very excited to introduce Gail Kapke. She is a wife, a mother, a grandmother. You can add in things too. A nurse for 43 and a half years.
Now retired.
Now retired. Woohoo! She has been with Young Living for 18 years. So pretty much from the start.
No, a few years later.
Yeah, a few years later. And she is also a Lyme contender and educator. So welcome, Gail.
Well, I want to thank you, Stephanie, for having me come tonight. I have several passions, and one of them is Lyme disease, and it's co-infections. I myself have Lyme. I have more family members that have Lyme. I have about 10 to 12 friends and relatives that have Lyme. And so it's been a journey together about, first of all, what is it? How do you get it? Who's at risk for it? And certainly, how do you treat it? So I could talk about this for 2 days, and we're sort of scheduled for 30 minutes. And so what I've done is given Stephanie my PowerPoint. It's a few years older, but it's still very pertinent. And then you have the oily community notes in her files. And I don't know if you got my video in there, but hopefully we'll get the video. Did you get the video today of my arm?
Yes, I got it, but I didn't put it in the group yet. So I'll add that later.
There's only so much you can do at one time.
Yes.
So we might as well get started because I've got a lot of things spread across my desk to talk about. So far, I think it's been a bad tick year, and ticks are actually year-round. And ticks are not the only vector that spreads Lyme disease. There are mosquitoes, there are spiders, and other insects that now carry that because they also bite the squirrels, the mice, the rodents, the deer who are affected with it, and then can spread it along to you. Yep. And so Lyme is just Lyme, it's not limes. And this is It looks so small in the picture for me, but this is the spirochete.
Okay.
Some people call it a bacterium, but it's a spirochete. And that looked huge. It looked like a big snake, but it is about 8 to 22 millimeters long. It has a little, almost like little antennas, and it can sort of fish its way along through your system. It can attack any organ, including your brain, your bones, your heart, your bowel, your skin. And that is why all the symptoms are so different depending upon what organ or organs are affected. Okay. So Lyme was actually figured out in 1977, which seems like so long ago, but in terms of medical science, that's not really that long. There were arthritic symptoms in kids who lived in and around Lyme, Connecticut. And so they were studied as to what is going on in that region. So there must have been a high rodent population that had been affected by the ticks, quite a swarm. And so that's sort of where it got its name from. In 1981, this was actually identified, so that's been even less time period. And there's many co-infections that you can get. It isn't just Lyme, or the correct name is Borrelia butyriferi. And if you can see that there, it's probably backwards, but I can put that in the notes too. And so it changes into several different forms, which makes testing very difficult. And then add in co-infections. I have a sister-in-law who goes to the Fond du Lac Wellness Center and sees Dr. Abfall, who is on the Oily Community Notes. She's a naturopath who specializes in live blood analysis. And she says there are now believed to be 101 at least co-infections. So who is at risk for getting them? Well, certainly I'm at risk because I love to be out walking in the woods. We have had dogs recently, lost one about a month ago and about a year ago, and both had gotten ticks on them and brought them into the house. So that's a very, very common way. We have a real fine-tuned sort of like comb that we comb through their hair, because one was a black lab and one was a coonhound with a lot of thick hair right in the area where the ticks go. And so we'd have to really be religious about putting things on them to try and help repel, and then also checking them out. And sometimes you feel like you've checked them all out, and by the next morning you're petting them and you feel a bump behind the head. And ticks will crawl up. And so I'm at risk because not only do we have the forest and we take walks in the forest, we have a 70-acre farm in central Wisconsin, but I love to garden. So yesterday I was sitting out in the garden for about an hour and a half, clearing a 10, 12 foot by 3.5 foot area of those invasive crabgrass reeds that were bothering my potatoes. And so that's a prime time for something to just come running along and start to crawl up. They say you should wear light colored clothes. I don't have a lot of light colored clothes when I garden because they're going to get really dirty. You should tuck in your shirt, and you should look a little bit like a youper. We used to have a place in Upper Michigan. They had ticks too. And tuck your pants into your socks, because I wear leggings, and if the ticks get underneath your leggings, you never know where they're going to be. This year so far, I had one embedded about right here.
Oh, wow.
And I had one embedded just right next to my belly button. And it's really hard not to freak out when that happens. But you have to sort of take a breath and calm yourself and take care of the situation. So there are a few tools to use, and there are a few things not to do when you find that you have a tick. You can use a tweezers. I don't know if you can see that really well, just a regular tweezers, and go as close as you can to where the tick is into your body and pull straight up. In the past, we used to think that you should spiral that. That's not any longer in current thought, because how do you know which way to spiral? Could be one way, could be the opposite way. There's a little, like a hook kind of device, and that's for the bigger ticks, and this one is for the smaller ticks. There we go, that's there. So there's two different sizes. And there's a few other type devices that are out. What you do not want to do is put any fingernail polish, any sort of Vaseline. Don't light a match to that tick. You are going to irritate the tick. Won't that irritate you if somebody did that to you?
Mm-hmm.
And it is going to spew more into you when it's irritated. And that will accelerate the process. Now, in my PowerPoint, when you get a chance to look that over,
Mm-hmm.
current theory back in 16 when I did the PowerPoint was that it took, and I've heard pediatricians I've worked at 2 hospitals in the last 5 years, and I heard one pediatrician say, when the tick is, oh, there you go. My husband's so good. Here's the,
Oh, yes.
he says this is the best tick remover for dogs. And he even used it on my hair the other night when another tick got in my hair.
Mm-hmm.
So thanks, husband. I also sort of feel like when you have had tick bites, they seem to be attracted to you more. I don't know if somehow there's some sort of communication that this is a nice human host to live in. And so with the same amount of walking around, my husband sometimes does more. He gets a lot less ticks than I get, but he's not always sitting on the ground as well. Sometimes it's in his tractor and his other kind of things. Mm-hmm. So once you got the tick removed, there's a few options. First of all, you want to smash it dead because you're so upset. And you probably don't want to do that. You can find your baggie. This one happens to be one I have for the grandchildren. It's from Frozen. It's got that little monster on it. Yep. And put the tick in the bag and seal it up so it doesn't get away. Mm-hmm. Okay. I have known vet techs who have worked with animals and they have taken ticks off of dogs. They should always be wearing gloves. Mm-hmm. We have a special block out on the deck and a spoon that we don't use to eat with, and we smash our ticks that way. Mm-hmm. Now, sometimes I'm going to take the camera here, and I don't know if you can see my PowerPoint there. Can you see this, Stephanie?
It's a little, yeah, I can't really see it.
Okay. All right. Ticks come in different sizes. There is little tick cards that you can get from the DNR and from other places. And it's sitting on here somewhere, and you can keep that in your wallet for tick identification. Okay. Some are so tiny. They're the nymph size. So they are like the size of a pinhead. I am a person who is half Irish. I have a lot of spots on me. They're called freckles. Mm-hmm. And now because I've gotten to be grandma, there's some more spots that are forming on me. And so you really need to do a thorough tick check, not only on yourself, but on your spouse or your other family members, but on your children. Every fall, I see lots of pictures of kids jumping in the leaves piles. That scares the heck out of me. Mm-hmm. Because a big pile of leaves sitting overnight, that's a real nice cozy haven for the ticks to go in. Mm-hmm. Walking in the tall grass is another hazard. I also believe that they can drop down from shrubs and then from trees. Mm-hmm. We took our first walk really early March in the woods just to sort of check it out. And our dog was with us then. And I looked down and I had about 5 little tiny ticks on my legs. Wow. So we sort of got those off of there and vacated the premises so that we could go back and at least get repellent on. Mm-hmm. Now, the Lyme Disease Association, there's several of them, has a lot of guidance on there. And so they have this little nifty picture, and they tell you that you should walk in the middle of the trails. My husband has been doing a fabulous job of taking his brush hog behind the tractor and cutting the trails nice and short so that when we take walks to the path and hopefully the deer and the turkeys and things like that, we can get out of the high grass. Mm-hmm. Wear a hat. I always wear a hat in the garden because I don't want to get a sunburn on the top of my head. And sometimes it's a baseball hat, and sometimes it's one of those old lady gardener hats that has the really big brim. Mm-hmm. Because that'll keep it off your hair. And my hair would be an attractant. So if one landed down here, it's just going to crawl up. Mm-hmm. And so I usually have it tied up on the back of my head and a hat on. And then I have repellent on. Now, when Stephanie adds the video that I took, it was a couple years ago. I was working with flowers right on the side of my deck, about 15 feet away from here. When I got done weeding around the flowers, I brought my arm up. There was a tick right here. And it was a dog tick. It was a little bit bigger sized tick, and it had the patch on it. And it started to do its thing, started crawling up. So I quick called my husband. And I said, and sometimes you're just walking out to do something and you don't always put your repellent on. So that's usually when I get caught. And I said, go get the repellent that Young Living just made. And I had seen lots of things on the internet where they took a bowl or they took a plate and drew a circle with the insect liquid repellent. And so he took a stripe over my arm about 4 inches above the tick. And as the tick came walking up, when it got close, you could just see it rear back. And it didn't want to go over the line with the repellent. So that made me feel really good because I'm a human and that was on my skin and I wasn't a plate on the internet. So I knew that it was a good one to do. So I always put repellent around my socks. If you don't have this yet, try some lavender on there. Make sure that you are protected. Now, I wouldn't be walking around in sandals either because they can get into your feet and get into your ankles. So if you're going to be doing lots of woods work or garden work, then I would wear real shoes. And I know some people are just really warm-blooded and they don't like to wear shoes very much. And there's a good thing called earthing. But at this point, wear your shoes and your socks. Long pants. And some people even take duct tape and wrap it around there. On the Lyme Association, it does say consider DEET for skin. And after being in natural health for almost 20 years, I do have some concerns because I'm older. I'm trying to detox from a lot of things I've been exposed to in my life, and that makes me a little uncomfortable. However, I want you to do your own research and I want you to do your own thoughts because you should be protected. So you could spray your clothes, let them dry out a little bit, and then put them on, and that would be a little less exposure on your skin. Permethrin is also another ingredient in the commercial sprays. And then do tick checks. I think I was talking about that pediatrician, and I got sort of offline. So I heard a pediatrician at the smaller hospital in this area say to a couple who loved to go to the parks and walk outside, and they had their first baby. So she said, put mosquito netting over the stroller when you go for your walks and your runs in the parks, and do a good tick check. Look in all the crevices under the arms, in the groin. If they're going to crawl up, they might be behind your ears. I freaked out. My hairdresser one day, I went to her, and she's pulling up my hair so she can do this thing that she does, and there was one behind my ear, so I freaked her out pretty good too. So I think sometimes when I look at the people who are affected in different ways, I'm just so glad to be waking up in the morning and living and breathing and not being too impaired. And I have a theory for why that is for me. Anyways, in my PowerPoint, there's a lot of written up on the main co-infections. And back to the pediatrician. She said, don't worry, if you find a tick on your child, it takes 24 hours for it to inject. And that is current thought. Some people think even longer, which gives everybody hope. However, I read in another book when I was doing research for my PowerPoint, and I did a talk at the hospital for my unit, that if the tick has started to feed on your dog and your dog sort of goes like this and itches and the tick gets fallen off and then finds another warm body, which is you sitting on the couch, climbs up and bites you, that it can deliver its goods, or actually its bads, in 10 minutes or under. So that isn't the theory of mosquitoes either, is it? You know, mosquito bites can give you West Nile, they can give you lots of other things, and they don't have to be sitting on you for 24 hours. So I like to think that I don't believe that at all. So I had a chiropractor that I was going to in Waukesha, and he had a strong family history with his wife of Lyme disease, and she had it before they even met in chiropractic school. And so in his office, he had a tick kit, and this one happens to be by Pharmacem Labs. If you look on Amazon, there's several, and they're reasonably priced. This one was $38. And on the back, it tells you that it will also test for several other diseases. So babiosis, auriculosis, cat scratch fever. There's Rocky Mountain spotted fever. And so that would be helpful if you send your tick in, because then at least you knew what your tick had or didn't have, to give you a little bit of peace of mind or what you need to work on. Okay. All right. So in the oily community notes, there is a full page, tiny, tiny type, 2 columns of symptoms of disease. And a lot of these are very, where you can just sort of brush it off for anything. So you could have a headache. Who doesn't have headaches? You could have some pressure in the head. You could have some twitching. Dr. Jay Davidson, who is my chiropractor and who is now one of the world's Lyme experts and lives in California and does summits, like whole week-long summits with speakers that are the most popular scientists around the world. That if somebody has Bell's palsy, where their face is sort of droopy, that is a definite sign of Lyme disease. You can have some increased floaters in your eyes. You can have double or blurry vision. You can have pain or swelling. You can be overly sensitive to light. You can be overly sensitive to noise. Lyme disease is the great masquerader. And we did a class about 6 years ago, 5 or 6 years ago. My granddaughter was born already. And we had people in the audience, and Dr. J was speaking, so we had over 50 people in the class. And several of them came up to us afterwards saying that they were initially diagnosed with ALS or with MS. Those were the 2 big ones that we had in the class. And instead of looking a little further and seeing what caused symptoms similar to those diseases, because a lot of those diseases there isn't definitive tests for. Chronic fatigue, fibromyalgia, Alzheimer's. I truly believe that my father in later years probably had a trauma or a stress, and it brought out the Lyme and the co-infections again, because he retired and he was such a people person and he worked late in his life. So he was retired, and that, it's a major adjustment. I'm enjoying it, but I think that he had a little bit more trouble with it. And he would have some hallucinations. He was very sound sensitive. When he turned his neck, it would crackle, crackle. That's another hallmark sign. He had difficulty finding words. They thought he had Lewy body dementia and Alzheimer's. When we were cleaning out the house, when my mom was in memory care and my dad had passed, we found lots of articles from the late 70s and early 80s on ticks. And I knew he was bitten, and his high risk was he was a hunter. So if you have friends and relatives or spouses that are hunters, or I am a hunter myself, that is a huge high risk. One of the realtors who was showing us properties, when we went to see him for another property, he was very thin, he looked very sickly, and he shared with us that he had got Lyme disease. He got bit in the knee when he was hunting. Okay. The problem with getting the ticks back out is, and not everybody gets the bullseye rash, and there still is old knowledge around, because 2 years ago, one of my friends from Mugwanago, who has been working on, and I consider her to be an expert, many, many people call her for advice, and she keeps tick kits to one of the main labs in Igenics in California, which is a Lyme specific lab.
Okay.
They told her brother, no, you didn't get bit by a tick because you didn't get a bullseye rash. And it's like 40 to 50% of people will get one. So that is not a definitive thing.
I thought it was even less, at least
Yeah.
like when I was looking, I thought it said something like 7 to 20% or something. And
Okay, all right.
it was,
Could be updated.
yeah.
One time when I was bit by a tick in my upper thigh, I think it also went into cellulitis. I had a red mark this big on my thigh. I kept dropping my drawers at work when in our little back report room in the doorway of the bathroom going, you guys, look at this, look at this. You know? So let's see, so we covered that. Year round, the length of time we've covered, how to remove, what not to put on them, what to wear. There's several practitioners who are experts in the area, and that is in the oily community notes. Dr. Carol Brown works out of Oak Creek. She is an integrative doctor. She's amazing. We have seen her with one of our family members. She was a terrific help. She looks at you and assesses you, and a lot of times your first visit is several hours. She does not take insurance. Many of the natural doctors or the integrative doctors are out on their own, not related to hospitals, so they take straight pay. But you get what you pay for. There's another there's another group that told you my sister-in-law went to. Dr. Moress runs the clinic in Fond du Lac Wellness Center, and Dr. Abfall is the naturopath, and she's amazing. She tests my sister-in-law's blood every time she goes up there, every 3 to 4 months. And this is a nice tool for detoxing. Does anybody know what this is? It's a dry brush. And you work your lymphatics. You brush your body down before you shower so that you can keep things moving, because your lymphatics is part of your detox system as well. She can tell on the blood work if my sister-in-law is slacking and not keeping up with her dry brushing just by looking at her blood.
Wow.
Okay. So that's pretty amazing. She searched for 2 years. I'm going to sort of go into stories. What time do we have here?
It's okay. I think we're okay.
Okay.
I don't know where.
My sister-in-law's story is that she likes to garden. She has raised beds, so she's not quite sitting on the ground like I am. But she's out in her yard all the time. At one point, we lived in Big Bend, and our dogs, so this is not a forested area. We had a few trees and shrubs in the yard, but the dogs were bringing in ticks just in Big Bend, which is south of Waukesha. So my sister-in-law lived in Eagle. She's sitting on the side of her garden bed weeding, and all of a sudden her whole body goes numb. And it lasted for about 2 or 3 minutes. She was having bad trouble with her thyroid. She had pricking in her neck. Her husband said he'd come home and she just didn't have light in her eyes. It was like, it's like no lights are on, you know, nobody's home kind of thing. She sort of regressed into herself a little bit. And that's one of the symptoms you also want to watch with children, because it can mimic autism and regression from that. So she went from place to place to place, doctor to doctor. She went up to Red Wing, Minnesota. She saw a naturopathic doctor in Brookfield who was suspected Lyme, and put her on a dose of doxycycline. And you have to be on a long enough dose. If somebody gives you a 7 to 14 day dose, that might not catch the cycle of the hatchings and the life cycle of the tick. So, and when Dr. J was participating in the Goodwill talk, he had a really cool video on the spirochete, and it was on the dark field microscopy. So we had a little video, and when the antibiotic went into the person's system, the tick went into protection mode, opened up its mouth, swallowed itself, and went into cyst form, and then would bury itself in your tissues. So it's very hard to get an accurate test from ticks. Dr. J felt at the time, this was about 5 years ago, 6 years ago, when one of our family members was diagnosed, that I spot Lyme's at Parmesan Lab. was very accurate. His wife was 80 on the test. And my dear family member, here's her test. She was over 400.
Mm-hmm.
She was in the hospital at the time, so I notified the doctors in the hospital. They did a Western blot, and it came back negative. So they said, nope, you don't have Lyme. There's not a timing with testing, and when you have the infection is sort of crucial. And the Western blot, I found out later, can sometimes be 50% accurate. And different labs test with different bands.
Mm-hmm.
And so some of them have a higher rating before they call it positive. On the 23 band, there's a number of bands that they test. And some of them have a little bit more sensitive lab. And so either the Pharmacen labs in Wisconsin or IGeneX. Many doctors, and you'll see in my PowerPoint, don't feel like you need to be tested that your symptoms list. And in the PowerPoint, there's 2 different doctors' symptoms lists. And you check it off, and they will diagnose you on your symptoms. And that many feel are the most accurate. So back to Dr. Jay Davidson. He's got 2 books out. This was his first book. Okay.
Mm-hmm.
Here he is on the back.
Mm-hmm.
Okay. I have this on Kindle. We stained our deck one year. We listened to it 2 times in a row. It's hard to take notes when you're listening to something on Kindle and you're staining your deck.
Mm-hmm.
But it's amazing. So it says 5 steps to restoring health protocol, helping those who have not been helped with Lyme disease, thyroid problems, adrenal fatigue, heavy metal toxicity, digestive issues, and more, because it's all related.
Mm-hmm.
This was his second book, and this is the shape of a tick, and all the words in the tick and on the legs are some of the different symptoms. Dr. Jay's passion because of his wife,
Mm-hmm.
and I'm just so lucky we crossed paths, that divine intervention. We've talked about that before.
Mm-hmm.
His wife and him had a baby a year before my granddaughter was born. And so he recognized all the symptoms, which mass postpartum depression and raging and anxiety and just wild.
Mm-hmm.
And so when I was complaining one day that I was living with another family member, trying to take care of them, take care of the baby, and it was so hard and so tiring and exhausting, and I didn't know what to do for help. And he looked at me and he goes, Gail, I don't believe in some of the emotional things. I want you to get her tested for a tick. And I thought, okay. We used to go up north to my parents' cabin where my dad had gotten exposed and my mom as well. And we had done a little bit of camping and things like that. And so we were grasping for straws. So we did have her tested in the middle of the week. We went to one of the labs, sent it in. We did the symptoms list. It came back to him, and he pulled me over before a healthy talk that he was giving in his office. And he said, I have some bad news for you. And he said, she has Lyme disease and her titer's pretty high. And I was elated because we had something concrete to work on.
Mm-hmm.
And so we were lucky. We got to be put in a study that the scientist at that lab was doing. And he would give us 2 more free testing kits, which were $4.95. So I was all for that. If she would take his little botanical tincture, which is biocidin,
Mm-hmm.
and that's on Amazon. So we thought, sure, what the heck? And so we were reading and we were learning, and the hospital her regular doctor didn't think she had Lyme. So we were working through the chiropractor. And when I looked at the back of the herbal tincture, I saw that it had a tiny amount of some of the essential oils that I had used for years.
Mm-hmm.
So we might have skewed some of that study, I'm sorry to say, but we're not just in it for the study. We want to have her survive. And so some of the same essential oils that were in the herbal tincture were in the raindrop kit here.
Mm-hmm.
And so once a week, which is pretty frequent,
Mm-hmm.
because at minimum quarterly, you want to do a raindrop. 9 oils went up her spine and were feathered in. And that's when things started to turn around. Her numbers started to get, it was very supportive to her immune system, and her numbers started to decrease. Back to when you first get the tick bite, there's another oil called Purification. And that is a blend of at least 8 different oils, one of which is lemongrass and rosemary, lavandin. And so you would want to, after you get the tick out, plaster the Purification on that tick bite. And that's what I've been doing when I have been having my tick bites as well.
Okay.
One of my intuitive friends at the time, she's an animal communicator, and some of you may know that from having pets. She said, Gail, I was told when I was thinking about this that you should do the raindrop with the oils of the Bible kit, which were a completely different set of oils. And that was also very, very helpful. And so we were excited to be able to additionally do some things that really helped. Now, at the time, we're pretty sure that for her, it was invading the brain. And here is a brochure in my PowerPoint. It's 2 pages on neuropsychological or psychiatric Lyme disease. And so I was looking at this, and I was looking at Dr. Daniel Amen, like Amen, website. And if you have some symptoms, and it lists them all here. And this is something you can give to your doctor. Anxiety, depression, rages, sleep disorders, dizziness, OCD, hyperactivity, autism spectrum-like disorders, slow processing, difficult words again, decline in neurological function. Then you can give this to your doctor so that you can get some help, because you may be having, the thought at the time might be that you might be having this where there's other things that are involved. Does that make sense? Okay.
Yeah.
All right. So back to my sister-in-law who had the garden in out a little bit further than Big Bend. She had a lot of dental work. They had drilled through her sinuses and to accidentally put all that mouth bacteria right up through her sinuses, which is very close to your brain. And so that was a risk factor for her too. She had beautiful, beautiful long blonde hair down to her butt. It wasn't much longer after that, because she was also put on massive antibiotics, so it could have been a combination. She had unexplained hair loss, but the unexplained hair loss wasn't just losing some. She went completely bald except for a few little pieces here and there. And that is a very hard symptom, especially for a woman to work with. And that is one of the remaining things she's still working with. She has had some growth outward with the treatment. She's gone with supplements at the Final Wellness Center. She's had ozone treatments. And she had borrowed another device that I had bought from Dr. J, and it's a far infrared sauna. And she would do some of her detoxing along with her air brushing and her supplements to help with the flow to get things going and gone. A few times ago, so probably last year sometime, they did another live blood cell analysis, and they found some dead spidery kind of things in her blood. They didn't know what they were. It was probably another co-infection, but they were not alive and moving, so that was grateful. And some of those things can really bother you in the middle of the night. So when you are having hard times and hard health challenges, I know that you said you used this oil in the past, and here is joy oil.
Yep.
I am really attracted to the smells of the forest. So like the pines and the balsam fir and the spruce. And I love flowers, but sometimes a flowery smelling oil, I had to learn to love. But this does exactly what it says on the label. It brings you up. It helps you. And so this is a total whole mind, body, spirit approach that you need to work at, because I've known so many people, and the number one risk factor, I went to Gold Retreat for Young Living up in Idaho, and one of the girls in our group has a friend, and she had found out on the trip that her friend's partner had committed suicide. He had been working with Lyme symptoms for years and didn't feel like he was getting any help and felt hopeless. And so we need to do mind, body, spirit on all of that.
Yeah. Oh, I hated the joy oil.
Yes.
And
and what is the theory on that, Stephanie?
That you must need it.
If you hate the smell of that oil, it's probably because you really need it.
Yep.
And then it becomes an oil that you truly love.
Yes. Yep.
It's quite amazing. It's quite amazing. So I've given this, I've actually given this oil to a lot of people. And before I left nursing, I made little roll-ons for each one of the nurses. So summer was coming up and things were going on in the world. And so I knew they were having a hard time. So that, and some of the oils in the joy oil, there's one called Pomarosa. That is a very supportive oil to your system. And so not only is it raising your emotions up so that you can cope, but the blend in there, every oil has a lot of properties that are so supportive to your body. Okay. I want to go to a little bit more on a few stories, and then we'll ask for questions.
Okay.
And I'm going to have you do reading on my PowerPoint and on the oily community, so you get well-rounded education. Otherwise, this could have been a whole day's workshop. Out in Mugwanago, the one who carries the hygienic testing kits in her house, she has 11 co-infections. She believes that on a trip out west was maybe where she was first bit if she had to go back. It was a little less known then as to what to do and what to test for, because she's been working on this for a number of years, and she has spent over $100,000 out of pocket to find answers. Wow. Her husband also worked, he's retired now, for a city, and he was doing tree cutting. So when he's out walking to these trees to trim the branches and things, he's walking through the high grasses. There is some support to say that just like the spirochete in syphilis that can be passed from one person to another, is that something that can be passed with the spirochete for Lyme from one person to another. Sorry about that. But he recently has been dealing with Rocky Mountain spotted fever. He was exhausted. He had blood pressure problems. And then that's what they found out and have been working on that. So Terry has been very helpful. She's a big believer in bone broth. She was very sick and could hardly walk across her kitchen floor. And she called and she asked about the oils. And she had tried so many other things in her life. And I absolutely believe that the oils are nature's and God's medicine. The herbs of the field be your medicine. And this is not to say a substitute for the medicine, but this is to be an adjunct and complementary. And so she hemmed and she hawed, and another girl came on the line and she talked. And so finally she tried the oils and the Young Living Ninja Red, which this is good whole body support, because when your immune system is getting really kicked in the pants by these co-infections and the Lyme, you need some good nutrition. And this is some juices and some essential oils that are very supportive. You wouldn't believe what's in here, and Stephanie can show you lots of graphics on that. And it was about a month later, she was walking, she was doing treadmill, she was doing oil, she was doing her ninja. There was, Terry Seacrest came to Brookfield and did a talk. And so she said, did anybody have a testimony? Here's somebody who's been doing it for 1 month, goes up and grabs the mic, and she's telling all her story about how the ninja and the oils helped her from stopping to just sitting in a chair and feeling so fatigued. So it helped her immune system, so her immune system could kick in and help with what she was dealing with. And so the oils and the supplements are tools. Here's another one. Parafree. Okay. This has numerous oils in there, a lot of heavy hitters, and you take 3 soft gel caps 2 times a day. You can take it a little bit more if needed. And for best results, you do 21 days. Then you take a 7-day rest because it's giving your system a little bit of a break. And remember what we said, that the spirochetes are very smart. They're like, okay, the coast is clear. Well, the next ones come out, they hatch, and then you do another cycle for 21 days after it. So they recommend that you do 3 cycles.
Okay.
So that is very helpful. One of the things that makes Lyme and co-infections so hard to treat is called biofilm. And that's like, if you watch Star Trek, it's like their cloaking system. They hide behind there and you can't find them and they can't come out. And you don't want to do this with aluminum in there. I got this out of my, you want to do this. And I recently this spring had 4 mercury amalgam fillings removed. Holistically, I took supplements for about 3 weeks before and several weeks afterwards. There's a protocol to do it safely. My doctor I went to that was in Pewaukee. And so that makes me feel better that I'm getting some of that out of my system. So there's less to deal with for helping those little critters hide behind that biofilm where they can't be reached. Some local things in the area. This is not a Young Living product, but for animals, there's a company up in Portage. And when I was telling my daughter's story when I worked at the hospital there, one of the ladies who runs the animal rescue said, Gail, you got to go meet the retired local vet in town. So we went to meet him. I told him my family member's story. He brought this out in pellet form and a powder form. He had me taste it. And he said, all the cattle and the horses and the animals of the field are exposed to all of this. I have seen deer that have had ticks rung around their neck like beaded necklaces when they're bloated up. I've seen some of the squirrels on our bird feeders who have ticks on them as well. And so this is something that's used in the local area here to help with animals. It's called Gomer's Ink. Okay, there's a story behind it. Sounds really weird, but there's a story behind it.
Okay.
And he showed me that there may be a fair population in Portage who are not 4-legged, but are 2-legged as well. This is another product that our friend was using. It's called Mona Lauren. And these are little BBs. Can you see them there? Little BBs of coconut kind of product.
Okay.
So our friend who works for the DNR has many contracts. He's always out in the woods. For years, he has cleared stumps, trails, land. He's always working with machinery and he's out and getting exposed. His girlfriend happened to notice that he was getting some similar symptoms to her sister when she had Lyme disease. And so he also was having great trouble with his vision. And we talked a little bit about double, blurry, and he was starting to lose his vision. He had already been to his doctor and he had been through an ophthalmologist who could find no reason for it. So they took him to a local person up here who also does live blood cell analysis. And he showed our friend under his microscope lens the spirochetes swimming by, and told him that they're probably attacking your retinal nerve in your eye, and put him on a number of supplements to help his body fight that off, and his vision got better and came back. So with all those different stories, you can see how many different manifestations that it can have. Some of the co-infections can give you some shortness of breath. When you look in my PowerPoint, there's a man, it's a doctor, and he actually had a heart transplant. And it was found out later that he had, his heart was affected by ticks. And another anesthesiologist that I worked with at the hospital for labor epidurals, he had a friend who was a runner and was always outside, died at 51. They believed of tick carditis as well. And they said, well, Gail, on the autopsy, they couldn't find it. And I'm like, well, do you think that the testing would have thought of that or would have been sophisticated enough? It depends upon what is attacking his heart.
Mm-hmm.
Okay. There was something else I wanted to say. I was sitting up in the middle of the night thinking, oh, I should have told him this. I should have told him that. Okay. Along with the one in McGuanago, who's got the 11 co-infections, she had huge dental pain. Her face and her teeth were hurting. So she went and had a total workup. They could find nothing. Half of her body went numb. She had a total workup. They could find nothing. This is before she found the Lyme literate doctor. And she also had irregular heartbeat. So they did lots of testing. They did the Holter. They did all sorts of testing and couldn't find any reason for her irregular heartbeat. She takes care of that with cayenne pepper. So there is a lot of things that can help.
Yeah. Oh, that's
there
good. My husband does the cayenne pepper a lot.
There you go.
So that's, yeah. Good for him.
And helps dilate your blood vessels. Good for that. What else do I have sitting here? Oh, one of the big ones here. You can't read this because it's probably backwards, but this is inner defense. So when you first get bit, after you put your purification on, you start taking this baby. And these are oil caplets. I got to open it up because this is my brand new one. And it's a soft gel cap with very strong essential oils in there. There is the Thieves Blend. There is clove. There is, should have had the glasses on. We can put it in the PowerPoint for you. She's going to find it. Or I get this thing. And I would show you, it's nice and sort of a darker brown capsule. I tend to eat mine take mine with a little bit of foods for burping. And I have now taken it just by itself with just water or electrolytes or my Ninja and no longer burp from it because my body sort of craves it and depends upon it. And I have a funny story. We go to convention where we have 4 days of wonderful education. And it's mostly been in Salt Lake City. And we go to the farm, which is my favorite part. And we, one year, had it up in Minneapolis. And so we wanted to save money. So we had 2 girls in one queen bed and 2 girls in another queen bed. So we had more money to spend for our oils and the conference and things like that. Well, we knew we were going to be in with about 8,000 people. One of the last ones I was in had 40,000 people there from all over the world. Okay, it's virtual this year because the world flying is sort of shut down. I was taking this because I didn't want to be sharing general germs from being in with all that many people. And so was the girl and we didn't know it, so was the girl that was my bedmate. And the other girl had a roommate from Pennsylvania, and they were not taking it. So it was sort of like one of these cross-randomized studies because 2 did and 2 didn't. Guess who got the local thing that was going around that year? Both of them. So I felt very good that this was very helpful and supportive so that my body was stronger to take care of that, you know, to be stronger. There's one more thing that that people have recommended, and you know, veggie capsules.
Yep.
There's a little graphic here. Well, you could take a veggie capsule and put in 2 drops of frankincense oil. What does they say about the Bible about frankincense oil? Cures everything from a broken crown to a gouty toe. Gouty toe. Oh my gosh. Okay, time to stop talking. So it supports all those things. And then 6 drops of oregano. Oregano is a very strong oil. It was in this tincture and it is in the raindrop. And 12 drops of the Thieves oil, which is a wonderful blend that has a whole story in itself. And so that is in here, and you can also mix up this blend. And if you're having an acute flare-up, there's a procedure that Stephanie can share with you so that it is very helpful to give your immune system a kickstart.
Mm-hmm.
Okay. All right.
Absolutely.
I think we've gone well over our time.
Yes.
I don't.
You're right, though. I mean, yeah. I mean, I could sit here and listen to you for days.
I have stories because people have shared stories with me, and I learn through stories.
Mm-hmm.
And I have to say, there's been 2 really bad times in my life, and I mean, there's been more, but I like major bad times. And one of them was when my very close family member was affected, and the other one was with another family member who had a bad medical thing too. And those things just sort of shake you to your core.
Mm-hmm.
Oh, the last thing I wanted to say is that because I was a labor nurse for 40 and a half years and an orthopedic nurse for 3, I worked a lot with patients who were pregnant. And I remember a few patients, one in particular, she had a stillborn. And that is so hard to deal with. There's so many emotions. One of my daughter's friends from high school had an unexpected stillborn, but there was a mechanical reason. There was a clot in the cord. So this patient had a number of pregnancy losses and was sharing to me, when we were trying to induce her for another loss, that all these doctors guaranteed her, they had checked her over, fine-tooth comb, genetics, everything, that this was not going to happen again. And it did. So I was into my full tick searching then.
Mm-hmm.
And I looked at her and I said, I have a weird question to ask you. I said, have you ever been bit by a tick? And she looked at me and she said, yes, matter of fact, I have. We like to camp, and we were at this one particular campground, and I got a tick, and I was on the antibiotic for 7 days, and that was it. And I'm like, I said, you might want to do some research there. I had some limited research. It's in the PowerPoint about Lyme. Even if the mom has an infection early in the pregnancy and is treated with the antibiotic, some babies have had Lyme or spirochetes when they were born. Some babies who have stillborns, they must have done a very, very intensive autopsy, but found it in the baby's spleens or the baby's bones.
Wow.
So it looks like that there is some evidence that can be passed along in a pregnancy. So one of the first manifestations in children is hyperactivity and some of the other things that we were saying. So to have a good analysis, whole wide, well-rounded research as to what are things that are affecting you is really, really important.
Mm-hmm.
Okay. So, and this was a magazine that I subscribed to. It is also online. They have lots of articles. They have tons of people's stories. Some people are first diagnosed at 20 years. There's been many Hollywood stars and sports stars who've had their careers totally derailed because of Lyme.
Mm-hmm.
And there's many, many, many helpful books. So I wish you lots of research and lots of support in your journey with Lyme disease and co-infections. And just know there's people to listen and to support you along the way as well.
Mm-hmm. Absolutely. Yeah. Well, thank you so much. Oh my gosh.
It was a little bit scattered, but there's just so much I want to spew out at you, but you got a good foundation between the oily notes, the PowerPoint, and make sure if you can get that tick video in there with the repellent.
Yeah.
See if you can get that into the files eventually in the next few days.
Yeah, absolutely. I will do that.
Okay.
Well, thank you so much.
I'm not responsible for any pregnancies when I recommend all those really good, thorough tick bites, okay? That was not a way we raise business in my field of nursing.
Okay, so yeah, I will try to upload maybe also the PowerPoint as well.
Okay. Yep.
So
good.
Yeah, and then I know we had a couple people watching. There weren't any questions,
okay.
but
we might have lost them somewhere along the way, but they can replay.
Yeah, absolutely. Yeah. They're busy tonight. That's okay. All right. Well, thank you.
Can I share one more thing?
Oh, yes, absolutely.
Okay. Remember that story of the one in the hospital?
Mm-hmm.
Okay.
Yes.
So I had educated my unit on as much as I could with the PowerPoint and things like that. And they knew the experiences I had been through with my family. And one day we had a patient who had either, I think it was preterm labor, and beautiful family. I can't remember if they were Oriental or if they were Hispanic, but beautiful black hair. And the father brought his daughter. She looked like she was between maybe 7 and 8 years old. And they were sitting on the bed while the patient's nurse, who was not me, gave the discharge instructions for this patient. And the dad is just sort of stroking his daughter's hair, and he finds a bump. So the nurse and the dad and the mom separate the hair, and look, it's a full-blown gray big tick, and it's attached to her head. And of course, everybody's freaking out. So I get pulled out of my patient's room because now evidently I have a little knowledge in ticks, and nobody wanted to remove it. I did wear gloves. We did put it in a urine specimen cup because we happen to have a few thousand of those on the unit.
Mm-hmm.
And I gave it to them with instructions as to where they could send it for tick testing.
Mm-hmm.
And one of the Lyme associations had like scholarships, that's not a good word for it, but they had funds to help families who perhaps did not have good insurance to help with children who had been exposed.
Mm-hmm.
And so we gave them all that information and sent them home with the mom. So, but I'll tell you, that sort of freaked the whole unit out, because here's this little girl, she's sitting on her mom's bed and there's a tick stuck in her head. And of course it was summertime, so.
Yeah. Yeah, that's so scary.
Yeah. So.
Yeah.
All right, signing out.
All right.
Thanks so much.
Yes, thank you so much.
And when we get a new puppy, I'm coming to the Hounds group here and the holistic group, and we're going to get some good information for you.
Yay!
From you.
Awesome.
Yay.
Awesome. All right. Well, thank you so much.
Good night, Stephanie. Good night, all.
Okay. Bye-bye.